let you know this is a doctor from Health Department.
Hi.
So, Mr. Starr,
Yeah.
morning.
Good morning.
So my name is Dr. Audrey Coy. So I'm here to issue a medical examination direction, and I'll just read it out to you. So the World Health Organization declared COVID-19 a pandemic on the 11th of March 2020. On the 23rd of March, the Minister for Health declared a public health state of emergency with effect from 1:30 on the 23rd of March 2020 in respect of COVID-19 pursuant to Section 167 of the Public Health Act 2016. The public health state of emergency applies to the state of Western Australia. I, Dr. Audrey Coy, an emergency officer authorised by the Chief Health Officer under Section 1742B of the Act, to exercise any of the emergency powers while the public health state of emergency declaration in respect of COVID-19 is enforced. Direct Alan Starr, date of birth 24/1/1973, to do the following. So this is the direction. So medical examination. You must undergo a test for COVID-19 comprising the taking of samples in accordance with the Coronavirus Disease 2019 cDNA National Guidelines for Public Health Units from time to time, as soon as possible, and in any event within 24 hours of the making of this direction. Serology testing must not be used for the test of COVID-19. You have been given this direction for emergency management purposes to determine whether you have COVID-19 in the interest of preventing the spread of COVID-19. It's a penalty for a person to fail without reasonable excuse to comply with this direction. It's punishable by a fine of up to $20,000 by individuals, and if you do not comply, reasonable force may be used to ensure your compliance. Now, what I haven't on now, it's 11:45 on the 27th November 2020.
Okay.
I'm supposed to take a photograph of this. I
Yep.
completely forgot that.
No worries. I'll do that for you. You just put the first page first. Maybe.
So when you say reasonable force, I mean, what does that entail? Like I get held down and forcibly penetrated?
I don't know.
All right.
Are you able to provide evidence that the PCR test can isolate the actual COVID-19 virus? Because I've yet to find evidence of that.
Alan, can you just let the doctor serve the paperwork on you first?
Do you want that?
Just observing the distancing rules, yeah.
Okay, so the paperwork, I think it's deemed to be served on you. And now if you have questions, if we are able to answer your questions, we're more than welcome. You're more than welcome to ask, okay?
Okay, thanks. I appreciate that. Are you able to provide me with evidence that the RT-PCR test is able to isolate the actual COVID-19 virus and not other viruses?
That's not a question for us, I'm sorry.
Are you able to pass that question on to the people who are handing these notices?
I can do that.
Yeah. Yeah, I mean, why am I being asked to undergo a test when I'm displaying no symptoms and I'm perfectly healthy?
I think I've explained it in the direction.
Why, after 12 days of home quarantine and I'm still displaying no symptoms, am I required to get testing?
Again, that's in the directions.
Okay, I don't have any further questions. I appreciate your efforts in attempting to ensure the safety of the public. I'm also attempting to ensure the safety of myself and those around me, and I don't understand these directions, and I don't believe that they're in the best interests of myself or the people around me. So that's why at this stage, just as a statement, I'm refusing the test. To my understanding, it does produce false positives. Then those false positives are put on the news as cases to scare the public. I don't agree with this. And that is one basis for refusing the test. The other is I don't agree with forced bodily penetration of any sort. I won't be accepting any vaccines. And I'm still very reluctant to do this test. I will have a look at the information you've left here with me. So, is there anything else I can do for you?
That's fair enough. Like you have your own opinions.
Yeah.
We have our own opinions as well. But this is the direction being given to you, and obviously the direction has been given to anyone who's subject to quarantines for 14 days.
Yeah.
Not just one of you, or all the persons who arrived in WA who are subject to quarantine. So it's not just one person. So we just wanted you to do the right thing.
Yeah.
When I say right thing, is from my point of view, the right thing.
Yeah.
And there will be consequences if you don't, as you probably been told already.
Okay, sure. Well, I'd just like to share again that I was granted entry into Western Australia on the understanding that I wouldn't have to test, that I wouldn't have to quarantine, and then that was changed around on me.
That's right.
So I'm, I don't know if I would have agreed to come back into Western Australia if I'd known that.
Yeah.
And I've agreed to quarantine and requested that be a compromise without testing, and I don't see any harm in that. If I'm here for 14 days and still displaying no symptoms, I don't see that there's any problem.
Yeah, I think to a degree I understand you because of the situation in South Australia.
Yeah.
People, you're not the only one, people coming back from South Australia to WA, and with an understanding as to the not need to do the quarantine.
Yeah.
Unfortunately, something happened over there, as you probably know, 2 weeks ago, and everyone's been required to do exactly the same thing you have been required to do.
Yeah.
So that's the situation.
Yeah.
And it's like, from my point of view, what you have told me sounds like you care about yourself, care about the safety of WA people, and this is what we do.
Yeah.
The reason for us to do that is we or whoever makes the decision care about the people in WA.
Well, yeah, that's the thing. I mean, I understand that you think that you are doing that, and I appreciate that.
Yeah.
If things continue and we wind up in any situation like Victoria, small businesses decimated, suicide rates are up, alcoholism is up, domestic violence is up, then I really question the decisions of the authorities in this point, and whether the restrictions are causing actually a lot more harm than they are preventing.
I don't have the stats about this one. You probably wouldn't have the stats about this one either. But whatever directions you've been given, that's the direction stands. And basically, the paper was served on you at 11:45 today.
Yeah.
You have 24 hours to do it. So by tomorrow, which is the 28th of November, at 11:45, if you haven't done that, then there will be consequences.
Okay, I'll consider it. Thank you.
Thank you. Bye. Cheers.
And stay well.
Yeah, you too. Have a nice day. Thank you.